Hi, I'm Chip Hardwick. I'm the executive for the Synod of the Covenant, and I want to invite you and welcome you to this website. All of you that are here, this webinar, all of you that are here in person right now, and all of you who will be watching later on video. We are so glad to be partnering with Science for the Church for this presentation today. I'll introduce you to Drew Rick in just 1 minute, and he will introduce you to our panelists today. But first, I want to let you know that if you have students in your congregations who are in undergrad or vocational school or associate's degrees or their first theology master's degree, our scholarship application is now up and available for them. It'll be available. They need to turn in everything by May 31st, and we will announce the winners by June 30th. So I hope you'll take advantage of that. Also, in April, you can find on our website a presentation or a webinar series on clergy loneliness and also boundaries training. So those will be coming your way, some of the ministries we have to support your churches and your presbyteries. I want to open us in prayer, and then I'll turn it over to Drew. Gracious God, thank you so much for all the intricacies of the way you created the world. We're thankful today, especially for science, the hard sciences that can help us understand our world better and that can help us to do ministry in more fruitful ways. So God, we pray that you would open our ears for this webinar. We thank you for each of our panelists, and we pray, oh God, that as we listen, we would grow and our ministries would flourish. We pray this in Christ's name. Amen. You who have been here before, you have met Drew Rick Miller before. He is the co-director of Science for the Church, which is one of our important partners. And Drew, thank you so much for being here, all your work behind the scenes, and I'll turn it over to you now.
Thank you. It's great to be here, and we appreciate the partnership with the Synod and the opportunity to do this important work together. So I'm really excited about today. There's kind of two goals that I have for the day. One is to very briefly introduce you to a model of how to engage science in the church that we believe very strongly in at Science for the Church, and which is exemplified by our three panelists and the ministries that they work with. And then the other is to give you some real practical tools for ways churches are addressing mental health. And so let me briefly do the introduction of the model. We call it the standard model. It's a play on particle physics, which has a standard model for how all the subatomic particles function and relate. We use that because we found that relationships between science professionals and church leaders is the optimal way to engage science in the church. And there's a whole host of different directions that can go. Based on the interests and the expertise of those scientists. Today, we're going to feature science professionals that work around mental health, something that you may already have in your congregation. You certainly have them in your community, and ways that you can partner with them to do important ministry together. But there's a whole host of other ways that this can happen. And what we like about this model, we encourage it as much as possible to use scientists, science professionals that are in your churches, because then you can do contextual work together. You're not trying to introduce somebody from the outside to the nuances, the worship style, the theology, the ministries, the ministry goals that you have in your church. When you're using people that are already a part of it, you're cultivating new leaders and doing work that kind of continues and builds on the momentum of your congregation. So I'm going to share with you a link where you can download a brief guide on the standard model. And again, I'm really excited to introduce you to our panelists today, two scientists and one minister who have engaged in these partnerships around programs that address mental health. And I'm going to address each of them kind of one at a time, and then give them a moment to a few minutes to kind of present the program that they have done. And let's start with Dr. Addie Weaver, who's a professor of social work at the University of Michigan. I'm going to be brief on her bio because I think it's more interesting to hear her talk about her program but she's doing wonderful work addressing mental health in rural communities, and doing that in partnership with churches and with clergy. And so with that, I will let Addie take the lead here.
Thank you so much, Drew. I really appreciate this space and the opportunity to be here with you all today and share a little bit about ways that we've developed a clergy scientist partnership. Oh, I'm sorry, I wasn't ready for that to move yet. To address depression treatment access in rural Michigan. So we've created a program called Raising Our Spirits Together that's delivered in churches by clergy, or it can also be delivered on Zoom like this. And that's what I'm really excited to talk with you about today. So just to give you a little background, I grew up in rural Pennsylvania and saw a lot of issues folks in my, kind of family network, friend network, church network had in terms of trying to access mental health care when they needed it. And what I saw time and time again is folks either didn't have access to or did not want to seek care from mental health professionals. They were much more open to going to their clergy. So pastors often had a really full plate already, and then had folks who, really were experiencing some significant mental health needs. And I saw this pattern continue as, I moved to Michigan. Oh, I'm sorry, I'm not sure what's happening here. Where you can see here that the majority of the Michigan mitten is green, which means we're a pretty rural state. And there's a big opportunity, in my view, to work with clergy and really leverage the strengths that clergy have and the ways that clergy are serving as de facto mental health providers already. And so I began talking to clergy in rural Michigan counties in the southeast area of Michigan about how we might be able to kind of work together and collaborate, bringing together mental health intervention research science, clergy knowledge and expertise. I apologize here again. The visual and performing arts and technology to create a program that would support clergy in meeting the needs of their congregants and their communities in terms of mental health in a way that would not be a significant burden, right? Clergy are not trained to be mental health professionals, yet are often providing a lot of mental health care and have a lot of skills to bring to the table and really do help folks in meaningful ways. And so we thought if we could bring some of these elements together, we may have a really effective partnership and make a big impact on folks in the congregations and communities. And so what we did was develop Raising Our Spirits Together by integrating aspects of cognitive behavioral therapy, or CBT, that focuses on the connection between our thoughts, our feelings, and our behaviors, with the elements that clergy were already doing to support folks in terms of prayer, active listening, engaging folks more in activities of the church, helping folks to think about focusing on the positive, using scripture to lift folks up. And so we talked about how a lot of those elements had some alignment, right? So a lot of times in cognitive behavioral therapy, we want to help people be able to really understand the importance of taking action and doing things, even if you don't feel like it when you're feeling down. And clergy said, hey, well, we're doing that a lot when we talk to people with depression. We're inviting them to come to Fellowship Hall on Sunday nights for Bible study. We're inviting them to come to Wednesday night groups when we're writing cards to our congregants who are in the hospital or in nursing home care or otherwise. So we found this synergy. And the same with using scripture to talk about the importance of positivity and not getting caught up on those negative, unrealistic, unhelpful thoughts. So we found there were some really nice ways to work together to build a program that emphasized the strengths of mental health treatments that have a really strong evidence and research base, and the work that clergy are doing that also has a strong evidence base that works for folks and people continue to come to. So this just shows some examples of some of the content that folks might see when they're using Raising Our Spirits Together. We always have a scripture that connects to the session. And so the program starts out with prayer requests, and really digging into the scripture verse for that week's content. And you can see here we have some, panels that are clergy. We worked collectively to think about what are some, really specific things for the rural setting and for your congregants that we want to give examples about. And so we really worked together on that. Another key innovation of our program is we use that character-driven storyline, or this narrative, to help people understand what depression can look like and how we can use some tools like taking action even when we don't feel like it, connecting with others, connecting with the church, and also identifying our negative thoughts and replacing them or talking back to them with more helpful and realistic thoughts. So we follow Billy the Balloon as she experienced depression last year and talks with us about her journey with depression and how she got some help from CBT. And we see her, sort of navigate some different issues in her life. And it really gives a nice model for people going through the program. And just to give some context, why I think that this partnership also works so well is there's just been a lot of synergy with our clergy and church partners, because clergy get, in a really authentic way, just the fact that their congregants many times are suffering. They have unmet mental health needs, and especially in the rural contexts, but many other contexts as well, there's just a lot of barriers people face to being able to access care. So, we know there's a shortage of providers. This is particularly relevant in rural areas, but across the board in the United States. We also know that there are significant challenges around accessibility, whether that's cost, insurance status, having reliable transportation or public transportation, as well as acceptability. A lot of times people don't want to go to formal services. As I mentioned before, they're much more comfortable seeking help from clergy, from family, from friends, that existing support network. In addition, in rural areas in particular, folks often feel like there's this lack of anonymity. So they, if they do seek formal services, someone might recognize them, and then that might get, talked about throughout the community, and they don't want that. Where I've had people tell me, hey, if my car's in the church parking lot, that raises my, what people think of me in the community. So I'm totally, good with that. And so we were really excited to be able to, bring Raising Our Spirits together to rural communities in Michigan. And we find it's super innovative because it's building community capacity to deliver depression treatment. It is working collaboratively with clergy, who we know are preferred, highly skilled providers, often doing small group programs all the time in their churches. We were able to tailor the program specifically for the church setting and for delivery by clergy by incorporating some of those important elements that clergy bring when they're working with clients or with congregants with mental health needs. We're able to offer it for free. You don't need to worry about insurance. So those barriers are out of the way. We use that engaging character-driven storyline so that it kind of brings people in a different way than typical treatment. It's not so, kind of academic. It's more accessible. And I have to say, our clergy partners helped us create that character. So we worked with an animator, and the animator would give us different versions, and we'd get feedback, and we'd have weekly lunch meetings with the clergy and talk with them and kind of so it was totally collaborative in every way. We also worked really hard to provide simple, straightforward content that is all at a 3rd to 5th grade reading level. So very widely accessible across diverse groups of congregants and community folks. We did have an opportunity to pilot our Raising Our Spirits Together program with 2 churches. We had 2 clergy, and they each ran a group one time for our pilot. So we ended up having 9 people total. One group had 4 people, one group had 5. Typically, we, would not want to do more than 8 in a group. And again, you all know better than I do what kind of works best for the group dynamics there. But what we were super excited about is that people got better. We saw a significant reduction in people's depressive symptoms based on the Patient Health Questionnaire 9 measure over time. So before starting treatment, the average score among folks was 14.3. And scores of 10 or above indicate that people most likely have major depressive disorder or a clinical diagnosis of depression. At the end of treatment, their scores went down to 6. So that's more than a 50% reduction. And now this meant that folks are in the mild symptom range, no longer probably, at that clinical depression, not having MDD. So we were super excited about this clinically meaningful treatment effect. And we saw improvements were maintained at the 3-month follow-up. So we saw a little bit of an increase, but most likely stayed down. A similar pattern emerged for anxiety. And what was really exciting is participants completed an average of 7.3 of the 8 sessions. So people wanted to keep going. And part of that, I think, is because people really enjoyed working with the clergy and people liked the program. So right now we're doing what's called a randomized control trial, or a larger study of raising our spirits together with our church and clergy partners. We've enrolled 70 people. 56% of folks who have received Raising Our Spirits Together completed all 8 sessions, and 80% completed 6 or more sessions. So from an ethical standpoint, we can't look at the data yet because we're not done with our trial, but we have really encouraging results that people are coming and sticking with it. So they're voting with their feet, which is super exciting. So we have one of our clergy partners running a group right now. And so we're excited to wrap up our study this summer and really then think about our next steps, which will be to really figure out, how do we bring Raising Our Spirits to churches more broadly? And what do pastors need from us to be able to offer Raising Our Spirits Together to their congregants and in their communities? And so I just want to thank our study team members and our community partners, particularly Reverend Jessica Hahn, Reverend Lynn McClowan, and Reverend Mark Elliott, and my colleagues at U of M, Anal Zhang, Caroline Landry, and Megan Harrington. I also want to thank the National Institute of Mental Health, who funded our study, and really, again, appreciate your time and attention, and apologize about my PowerPoint kind of auto moving there. But thank you all very much.
Thank you, Dr. Weaver. We appreciate that. And we'll have time for questions at the end, but I want to keep moving through and let each of our presenters kind of give you that menu of different programs. And so next, I'd like to introduce you to Dr. Ikeshia Smith. She's a clinical psychologist in, I forget, are you in Canton or Columbus, Ohio? I know you're in Ohio.
I live in Columbus, but I'm from Canton, Ohio.
Okay, so she's from those regions of Ohio. And she's an expert in kind of family, children, adolescents. She's done a lot of work with trauma and abuse. She's moving into more work on things like gun violence and how do families recover from those situations. And she's done some wonderful work with churches as part of a ministry called Mind Your Business. I'm just blanked on the name of the specific program. Yes, and so she's done these programs in churches called No Judgment Zones. And so she's going to present and tell us a little bit about that. Dr. Smith.
Thank you so much. First and foremost, I've been sick all week. So if I sound a little raspy or I cough, it's because I've had a respiratory infection. So please excuse me. But I will quickly go through my PowerPoint. It's not as detailed as Dr. Weaver's, but I can definitely walk you through this program. Now, I want to be honest and say that this is not my program. This was not created by me. However, I was one of the individuals selected to be a part of the program. So this program, and I presented this literally last April, to another group of individuals, and I kind of updated a little bit, kind of covering what Mind Your Business is about. So Mind Your Business started back in November 2019, when a minister who I actually grew up with, his name was Minister Johnson, Rick Johnson. He could not be here today, so I said I'd step in and present for us. So Mind Your Business, basically we say for short MYB. It's just about faith, mental health, and freedom. And this is our CEO. This is Minister Marquez Johnson. So unfortunately, you guys won't be able to see a picture of me because you get my beautiful face today in person. So I just wanted to let you guys know who was the person and founder of this. And the reason why he started this is because he thought to himself, how do we address mental health in the church? He was realizing that there was a lot of things coming up for a lot of the members of the church that were going to their pastors and talking about some things that the pastors just were not equipped to handle. And so he thought to himself, well, how do we get mental health in the church? So he came up with something called no judgment zones. And so with no judgment zones, he wanted the mission to be about faith-based organizations empowering others through psychological approaches. And that just basically covers the mental and spiritual well-being of individuals, literally of all ages, genders, ethnicities, religions, cultures, lifestyles, classes, etc. And so his vision was to basically take leaders in the community and have them strive toward practicing psychological tools to help people cope literally with everyday stresses. So we thought there was no better way to do that than to have them come to the church and us sit around and have a conversation without no judgment. Didn't matter what they were going through, didn't matter what their background was. We were there to be a support to them, and that it was okay not to be okay. So with the no judgment zones, and I'll talk about that first, because I think that was our biggest success. It's, to me, fairly new. So with the no judgment zones, we have about 8 to 10 people that showed up. There wasn't really any cutoff, but I would say on average, we had 8 to 10 people show up. There was a point where I had where there was like maybe 20, 25 people showed up. So they have gotten big, just depending on who wanted to come that day. So what I was finding out is that when I was attending these no judgment zones, there was no structure to it. So I was like, well, we can't keep people here all day to talk. So, because people, if they got something on their chest that they want to talk about, they definitely want to get it off their chest. And that could take hours depending on what is actually going on in a person's life. So we decided that we'll structure it to 2 hours. And then I said, well, why don't we give them a topic? So attend this no judgment zone if you are experiencing depression, if you are experiencing anxiety, if you're experiencing trauma, if you're experiencing grief and loss. And so by structuring it like that, individuals were able to come pertaining to those specific topics. And that was a success because I promised them, hey, we start at this time, I'm gonna get you in, we're gonna talk, and then I'm gonna get you out. And sure enough, I stuck to that and it worked. I know that Dr. Weaver talked about giving some sort of screening tool. So I thought, we should probably do that in the no judgment zones. We should probably see where people are mentally. And sure enough, we gave them PHQ-9s, which is a depression tool. We gave them the GAD, which is an anxiety tool. And I didn't give them one for the trauma one, but there is one. I just didn't give them one for that one because that one's a little different. And sure enough, we definitely had a high level of symptoms, and then we were able to track over time if we had the presentation again for them to fill that out again, and those symptoms did decrease because they were able to attend these no judgment zones. The no judgment zones are free. We did not charge individuals, and we also partner with 2 different churches. So our no judgment zones were not always at the same church. We literally would go to one church, we will present, and then we'll go to another church and then we'll present, and different people were able to get what they needed at different churches. What else was I gonna say? I was the presenter for majority of them in my area. So I'm originally from Canton, Ohio, and that's where I was doing them at. Now, the CEO, Minister Marquez, is from Cleveland, Ohio. So he would do them in Cleveland, Ohio. But the good thing about when he did his Sunday morning. So there was a lot more engagement, there was a lot more attendees. So I think that worked as well. And again, this is a little bit of a newer program, so we're kind of trying to figure out the kinks here and there. But what I did learn is that Sunday morning seems to catch everybody's attention because that's when everybody goes and that's when they need it the most. So like I was saying, no judgment zones has been are literally our most successful. Other things that we provide is the hub, and the hub is something that we try to get a lot of resources to put in, so that way, just in case somebody needs help, paying their light bill, who do they go to? just in case somebody needs help with getting some additional food, what type of services are provided for them. And that way that we can provide that for them, so that way they're not searching around on the internet, going to different places when they don't have transportation. Outreach is another thing that we do, which is basically calling to see if there's if there is any list of any other providers in the area. Sometimes people don't know where to look to go for a therapist. Sometimes people are like, I have no clue what we're doing. So sometimes we outreach and try to partner with other agencies and give them a list of places that they can go to address some things. Also, I don't want to be the bearer of bad news, but we also had people outreach to us when there were people who unalived themselves. And there were pastors that were trying to get support as well. So we also offer that service to help with how to cope and how to connect the family to services. And again, we have Mind Your Business Mondays, which is basically, if you can't attend in person, you can see us online, because everybody has the internet, or you can go to the library, one of the two. So we wanted to provide Mind Your Mondays as a way to also put out additional ways to get mental health. And again, the no judgment zones. And here's what the flyers will look like. Here's one for Mind Your Business Monday. We did one for anxiety, and then there was a no judgment zone that I did that was grief and loss. And let me tell you something, the grief and loss one was very impactful. You will be very surprised of how many individuals may be carrying around something very, very heavy, and given the opportunity to speak about it, or not even know what to say. But this was an opportunity to provide that for somebody, and it was successful. But this is typically what our flyers look like. It may look busy, but they're bright, and you know what we're here to do. And I wanted to say what our biggest successes were with this, and how we've been doing the no judgment zones and the success of that. We were able to raise money and do our first mental health faith conference back in 2021, which was also a very big success. And as well as we did our first mental health gala, which is bridging the gap between churches and mental health agencies. Now, while we know that we're supposed to be putting mental health in the churches, we thought that it was important for agencies to know the same thing. Like, how are you also helping us and collaborating with these churches that are not getting the proper resources or the amount of resources that they need? How can they be a partnership to us? And so we had that July of last year. I put it on myself. I didn't know I could do something like that, but I'm here to encourage anybody that if you have an idea, just step out on faith and do it. And that's exactly what I did. I didn't know where it was going to go. I didn't even know if somebody was going to show up, but I was going to be there. And sure enough, there were a lot of individuals showed up. It was free. And with the Minority Mental Health Gala, we had speakers. We told them about our success with no judgment zones. And we also wanted to collect money, so that way we could pay for someone to either have mental health services, or we pay for co-pays. So, and again, hopefully in July, I will have a fundraising event where we can continue to have these galas every year to sponsor a family, as well as we wanted to honor someone at the gala, whether they have unalive themselves or lost from any sort of mental health challenge that they had. So we wanted to make sure that we did that. And then right now we're working on funding. That's a big thing for us. Staffing. There's not very many, as you don't know, I don't know if anybody knows, but there's not that very many African-American psychologists. I am one of the 4% in the country. So we need a lot more clinicians of color that can help go into these neighborhoods and into these communities and these churches and be a representative. I learned that through research, a lot of minorities and African Americans do not attend or go to seek mental health services for a plethora of reasons, but representation is one of them. So they feel very misunderstood, as if someone doesn't understand what they're going through. Again, partners, because we would like to definitely partner with our mental health agencies and let them know that utilizing their services is important for the churches. And recently, literally just 2 months ago, we were able to get 20 pastors complete mental health first aid. So that way they were able to understand the signs and symptoms that may be occurring that may be beyond their scope. And they know, like, okay, here's what I can do in the meantime while we connect you to a mental health provider. And then we'll be working on seminars to do as well to increase our mental health resource and accessibility. That was the goals for 2022. So those are the goals still for 2023. And here's my contact information. And you can follow us on social media, on Facebook. That's where we are. And so that is all I have. I was pretty fast, but I tried to make it very.
Thank you, Dr. Smith.
You're welcome.
That was wonderful. Thank you. So our last presenter is a pastor, a minister, Susan Jennings. She's at Westminster Presbyterian Church in Grand Rapids. And she's going to tell us a little bit about her role in kind of leading a collection of folks in her congregation who created a mental health panel for their parishioners and their community. So a different style program than the others, but one that was very much done from within the church and initiated by the church. Susan.
All right. Well, hello, everyone. So Drew has introduced me. So I am the Minister for Pastoral Care and Mission here at Westminster Church in Grand Rapids. And so I'm glad to be here with you all and presenting our mental health referral panel, which is our attempt to help our congregation and community identify and help find care for their mental health care needs. So this, the panel was developed because of the need within our congregation. Several years ago, we had a family whose infant son died shortly after birth. And when the father went to seek counseling, it was anything but helpful. And then a few months later, we had a congregational member that died by suicide. And so our congregation members that were close to those families, and of course the families themselves, were really struggling to process these very tragic events. And so it brought to the forefront our need as a church to talk about mental health care and to focus on the importance of it. So how can we do that? I want to start by saying that we are a large congregation. We have about 1,100 members. We're in a fairly large city. So we might have more resources available than some like the rural areas that we've been hearing about. So I just wanted to put that out there. But our senior pastor at the time created this a mental health committee. And it consisted of our pastoral care staff at the time, which I was part of. And then the other professionals listed here on the slide are members of our congregation that were willing to work with us to think about how do we respond to the mental health care needs in our congregation. So once we started meeting, we had different ideas of how maybe we could do this, but the wisdom of the committee members, the church member committee members, was that let's think about the mental health professionals in our community already, in our city, that we would feel confident referring our church members and other people to. And so the committee began compiling a list of names of trusted colleagues that they worked with in the mental health community. So once we put together this list of potential panelists, we created an application, and then our committee members reached out to these prospective panelists and shared information about the program and what we were trying to do. And then we had a interview process. Really, what was the interview? It was a meeting process, really, with these prospective panelists. And so we had the pastoral care team in these meetings, and we had one or two of the committee members that would join us in these meetings. And I just want to name that Suzanne Oglenhan, who is on this webinar today, as one of our church members that was part of this, that is a clinician and part of this committee. What we were trying to achieve through these meetings with the mental health professionals, we wanted to be more aware of them, their practices, their beliefs. We wanted them to be aware of who we were as a church and what our goal was, which was really to broaden the breadth of trusted care and concern for our church community and the community in our city. And it was also important to us that they realized the emphasis that we put on inclusion and non-judgment. What I would like to recognize that these mental health professionals were very generous with their time. They were interested, they were intrigued about the idea of this panel. And I think they were grateful really that a faith community was recognizing the need to partner with mental health professionals and to highlight the need for mental health care. And so the current panel now consists of 23 mental health professionals in our city. So after about a year of planning and meetings, we came up with our mental health referral panel, and you all will have access to this. We have this booklet that we put together through the committee, and it is a wealth of information. And I also want to say that this is available to anyone in our community. It's not just the folks at Westminster. So the panel is available to everyone. So, but once we let the congregation know about the panel, some of the outcomes included the development of the Barbara Mohawk Callum McFeeters Mental Health Fund. So we had 2 families in our congregation that wanted to eliminate the financial barriers for anyone that wanted to access mental health care. And again, this wasn't just church members, this was anyone in our city that needed assistance financially. And part of that was, well, and it was due to the fact that one of our church members, their mother, Barbara Mohawk, died by suicide. And then Callum McFeeters, he was the infant son that died shortly after birth. So these 2 families wanted to honor their loved ones and were generous in creating this fund. The other thing I wanted to mention is that the Mohawk family has a foundation that has, the last 2 years, they have provided a match program during the month of May, which is our Mental Health Awareness Month. And we continue to be overwhelmed and grateful for the generosity of the folks in our congregation. And so now, so I know we want hard data, right? This, when we think about the hard data, this is what we can come up with, is that through the panel, we know that 180 individuals or couples have benefited from access and use of the mental health panelists. Also, we know it's higher than that because we share this information very widely. It's on our website. You know, people might be accessing this and we don't know about it, right? So it's just been a very tangible tool that we're grateful that we have to share with folks. And other outcomes include this increased education and awareness, which we know is very important to continue the conversation around mental health care. And that has happened through our adult ed and faith formation programs here at Westminster. We've had the mental health professionals within our congregation and those on the panel that we've brought them in for a series of programs to, again, educate, increase awareness, answer questions about seeking mental health care and how it can best help them. And I think it's interesting to lift up the staff use of the panel. So this, you know, we started this process back in 2014, and then we rolled it out about the end of 2014, early 2015. And so the staff, because of the conversation and the education around the panel and the importance of mental health care, this panel became an encouragement and invitation not only to the congregation, but to our staff to pay attention to their mental health care needs. And so currently we have about 22 on our church staff, and we had 6 of our staff that did access the mental health fund or the mental health panel, myself included. It was a great gift. And, you know, we have to take care of ourselves so we can take care of others, right? And then I guess the final piece of this is the pastoral care consultation. So through our work on the committee with our church members, we as staff recognized, I mean, we knew this, but we again recognized the benefit of the expertise and guidance of the mental health professionals within our church and how they could help us with our pastoral care ministry. And again, to continue to understand and recognize the need for mental health care. And I guess I'll end by saying that our best resource has been the folks on the committee, people like Suzanne that have offered their guidance and their expertise and their knowledge and help us find the best ways as a congregation to continue the conversation around the importance of mental health care. So we are very grateful and we're just very grateful for them because they have really led this whole process, those folks on the committee that have come from within our congregation.
Thank you, Susan.
Mhm.
All right, as we transition into some time of Q&A, begin to prepare your questions that you can unmute your mic and kind of raise your hand or send them via the chat. I want to ask one question of each of our presenters. So I'm actually going to ask the same question to both Dr. Weaver and Dr. Smith, and that is, what's one thing you wish clergy, church leaders knew about caring for mental health? What's kind of one piece of advice you would give the clergy that we know from data that we've talked about in previous webinars are often on the front lines addressing mental health? What's one thing you wish they knew?
I would say for me, working in a predominantly African-American church, one thing I would let clergy know is that while prayer can be useful in, alleviating symptoms, so is therapy and medication sometimes. Sometimes at least in our community, we're solely told prayer or go lay down and there's other tools out there that can definitely help with the prayer.
I really appreciate Dr. Smith's comment there, and I would just build on that and say that I would share with clergy that, you all are making a difference for people, you're impacting people, and oftentimes you all are that trusted person who can open up that conversation. Maybe someone has never shared an experience with their mental health with anyone before. And you may also be that person who recognizes, hey, this is somebody that needs more than what we can do here, and perhaps provide that warm handoff to additional services when needed. And that's not always needed, but when it is, I think it can make such a big difference. And the work that Susan's doing, I think, is so impactful in that way of having that relationship between the church and formal, mental health providers. So there's that trust. And well, I know my clergy is going to help me find, a good path for me to, get better and feel better.
I'd like to add to what Dr. Weaver said. I have told other pastors before that you guys are the leaders and you're the trusted individuals. And I said modeling is very important. If you have a therapist as a pastor, I wonder how that would change the view of your congregation. So absolutely.
Thank you. Thank you both. Susan, what would be one piece of advice you would have for your peers that you've learned in working with the mental health professionals?
Just their generosity, really. They want to help, right? And so we have to do this work together, and that we can be frank with them about what we need, and they just join us in this work, and it's really helpful. And I just want to mention, if I could say, that our senior pastor at the time, when we brought out this mental health panel and brought it out to the congregation, he talked about his own struggles and made that very public. And I think we have tried to do that. I tell people all the time, I have a therapist. Yes. Thank you. Thank you, Jesus. Yes, I have a therapist,
Mm-hmm. Thank you, Susan. So it looks like we have a question from Scott in the chat. Let's start off with that. And it's a question about confidentiality for the care recipients. I'm not sure who exactly that's directed to, but if someone could comment on how you have thought about and how you address the importance of confidentiality in the programs that you're doing?
Yeah, so I really appreciated that question, and I answered in the chat as well. So what we do is we've worked with our clergy to address that issue, because especially in rural communities, there is stigma. And so coming together in a group and kind of naming that you're having, some challenges around mental health or depression can be hard. And so we talked about, what do we want to do? And so the clergy decided that we would set group expectations during the first session. And so one of the group expectations that is already provided, group members are able to share, and they kind of build their own group norms at the beginning. But one that is always present is basically confidentiality. We don't call it that because that could be kind of a jargony term. But what we say is that, things that are talked about in this group can be personal and hard to talk about. And so what is shared in the group stays in the group. And everybody agrees to those group norms and expectations on that first week. And we've found that folks really respect that. We've also found that having the group format has been really powerful for people to build community and understand that they're not alone in what they're experiencing, where they might have felt, oh, there's something wrong with me. Why can't I just get over this? Like, why can't I just get out of bed? Or why can't I just, do what I need to do? When they find out, hey, there are others that are feeling these same ways, maybe, it's not so much something that's just wrong with me. So it gives people a bit of a different perspective to come together and build that community.
I would have to agree. In ours, we also have them sign a paper basically stating all the information that we would collect will be for research purposes as well as confidentiality, and we have them sign a paper. That's both. And then we have them sign at the end, because we do take pictures if they want to have their picture like on the internet, or if they don't. So they have the option, to opt in or opt out.
Susan, how does it work with the panel at Westminster?
Well, right. It's always important. And like when I said we had 180 individuals, that was actually coming through use of the fund. And so because of HIPAA, we won't know we only had the first name and last initial. So we're really careful about that information. And also sometimes if we offer the use of the panel to a church member, we don't necessarily know if they use it or not. Sometimes they'll come back and tell us, but we don't always know the follow through with it, because that's for them to share, right?
Thank you. What are some other questions folks have? Lisa.
Susan, could you talk a little bit more about how the mechanics of the fund work? How you have people access those funds?
Right. We are not an insurance company. That's what I'm going to start with. So those funds are available. We have a couple forms. We have a request form that all of the panel, all the mental health professionals are aware of it. We've tried to communicate it over and over, that here's the request form. They just tell us, they determine the need. We're not determining the need. Mm-hmm. They know what the guidelines are. And so we always say yes. We've never said no, right? And then they invoice us, and then and then we pay them. And so we do keep track of that data. But again, we're not an insurance company. We're not nitpicking all of this. They are making the determination of the need, and we are blessed to be able to say, yes, we can help. So.
Thank you.
Can I just, may I just add to this? So
Please.
As a psychologist, so the mental health providers that are on our panel, they can determine, hey, this person has a really tremendously high deductible, or their copay is really expensive. Can you just help out with that? And so, like Susan said, any of the therapists that are on the panel can access this for any of their patients. Mm-hmm. And we, like Susan said, we kind of spread that booklet into the community. We encourage people to give it to their primary care doc to, so that they're aware. This is really for our community, not just the church members.
I think this is a wonderful program. I mean, I've used, pastor discretionary funds for emergency counseling services and, but this fills a different need than that, and really truly an ongoing need. And I also love it because my mom was a psychologist, and when she died, we set up a fund at my home church to provide memorial gifts in her honor, to provide emergency counseling services for those who needed. And I never thought about, kind of specifically doing that as a pastor, but it would be also a neat way to honor my mom in the process. So I'm grateful for you sharing this. So.
And I just want to mention one more thing. We do ask that the client make a contribution.
Sure, absolutely.
They are contributing to it as well.
Yeah.
Deb has a question in chat noting what we all know, that sometimes it's a member in the church, even a member of the pastoral staff, that can be the cause of depression, anxiety. Could one of you say a little bit about how you've thought about that in setting up the programs? And you're all working pretty closely with clergy and church leadership. So any advice for folks on the webinar on how to address that concern? It's a tough question.
It is a tough
So
question.
with our program specifically, and I don't know if this was geared more towards Susan, but I can share from our experience. We work with multiple clergy. So and folks are able to go to groups at their home church or not. So if someone is maybe having a bit of stress or depression or anxiety based on a relationship at their home church, they may feel more comfortable joining a group at another church. And so we had a long conversation with clergy about the openness and how clergy wanted to think about the groups and who could participate, whether we wanted to limit it to congregants or whether the wider community would be invited. And clergy were really open to having the wider community. And not specifically for the reason that was brought up in the chat, which I think is a really important one, but because it was viewed as a way for folks who maybe are not churched to have a really important connection and get plugged in to a church in their community, not just for this group, but finding, oh, this is a place where I can get, some really important community and support and have growth, not just in, my work on my mental health, but in many other areas of life as well.
I was going to add too, part of the reason that we did the interviews at the onset with these different providers, for somebody to make it to that point, I guess, we had to have 2 of the mental health providers on this committee know the provider. So it couldn't just be one person that thought this was a great psychologist or social worker. And then when we did those interviews, we asked, about how do you address faith issues? What is your own faith background? How would you address these kinds of issues? Because we really want to help people when they're suffering. And sometimes if providers don't have a background in faith, or they have a background in faith, they can say something like, well, you just need to pray more. Well, kind of like Dr. Smith said, well, praying might be part of what is helpful to someone, but there's actually evidence-based treatments out there, and we want to access those, give people those to recover, and heal. So does that make sense what I'm saying? Yeah.
It does. Thank you, Susan.
To the mental health professionals on the panel are not church members. And we made that decision for this very reason, so that if there was an issue, it didn't feel like it was going through the church. Now, does Suzanne and those other folks work with church members? Most likely, maybe they do, but they are not included in our panel for that exact reason.
So I am cognizant of our time, and I want to give each of our presenters just a quick moment for any final words that they have. I think all 3 of them might be available to stay on if folks have some additional questions they want to ask, but I want to honor that hour time for folks. So Dr. Weaver, Dr. Smith, Pastor Susan, is there any kind of final word you want to offer to the group as we move towards wrapping up here?
Thank you for allowing me to be here to present to you all. I really appreciate it.
Thank you.
I would echo, really appreciate the opportunity to be here today and for all of you coming to this webinar and, seeing the importance of thinking about collaboration between science and the church, especially in the area of mental health. And I would just like to share that I am very excited about potentially building more partnerships with clergy and churches. So if anyone is interested in thinking about, offering Raising Our Spirits together in their churches, we are moving in the direction of really wanting to be able to provide it more broadly and make sure we're supporting clergy who are interested in it. So I will put my email in the chat. And Drew has my information as well, but I would welcome further conversation with anyone who's interested.
So I'll just add my gratitude. Thank you. And it was great to meet Dr. Weaver and Dr. Smith and to hear about your programs. So I just encourage all of us to continue the conversation. Like we've heard, you never know what is going on. And sometimes that stigma of admitting that you need help and even to say mental illness is almost creates a stigma too. So it's really important to keep the conversation going and create spaces for our congregation and communities to share their stories and experiences so that they don't feel isolated and alone, because mental health care is so, so important. Good mental health care is so important.
Thank you, Susan. So if I may, I'm going to offer one quick final word too, and that is I've learned this in many, many phases of engaging science in the church. Scientists are not scary. There are many scientists that would really like to bring their talents, their skills, their knowledge to the service of the church. Don't be afraid to ask. Find those mental health professionals in your community. Maybe some are part of your congregation, maybe not. Reach out, ask, see what they can do to help you meet the needs in your church and in your community, because I think we all share a common goal of helping people to flourish. And right now, mental health is a real challenge for us. And so finding ways to use the talents of Dr. Weaver and Dr. Smith and Dr. Ogland-Hand and many, many others in your communities, I encourage you to reach out and do so.
Just before we go, let us give thanks. Let's give some happy hands to our presenters today. We are really grateful for you. I learned so much and I'm very inspired. I'm really eager for even more people to be able to learn from you all. It's very inspiring to learn about what you're doing. So thank you so much. And thank you to all of you who have been here today. I wonder if you presenters are able to stay after most people leave to see if there are any particular questions for you, that would be great. But we'll send everybody else out. And thank you again to our presenters today. And thank you, Drew, very, very much.
Thank you.